Hey everybody, it's Dr. Ron here. Oh, everybody's joining. All right, after Dr. Liam's scope, I thought I would follow up with my version of what fibromyalgia really is from the MD standpoint. So forgive me, I literally just got home, but I want to tell you guys a story. Hey Deb, hey Marnie, how's it going? I got home, I'm exhausted. Today was a 16-hour day for me. So, excuse me if I seem a little tired. I'm not even really clean shaven, but anyways. But let's talk. Let's just get straight to the point about fibromyalgia. Hey, Amy. So here's the deal. Throughout medical school, when we first about fibromyalgia, and I think I learned when I was 23 years old. I was in my second year of medical school, and then we have. Oh, Marty, don't crash your car. Wait till you get home if you have to. But in second year medical school, we learned about fibromyalgia in the pathology class, and actually, it was taught that the history of fibromyalgia really started in the 1800s, when it was originally diagnosed as a mental disorder, and the name was not fibromyalgia. I don't remember what the name was. I guess I should have Googled it and tell you. But it was after that it was turned into fibrositis. Itis means inflammation, and fibro means the muscular connective tissue. And then maybe in the 1980s or maybe late 90s or early 90s, it turned into fibromyalgia, and fibro means connective tissue. Mya is a muscle, and algia means pain, so muscle connective tissue pain. So they dropped the itis at the end of the word because they think that, well, it's no longer a inflammatory disease, right? For those who are just joining, my name is Dr. Cheng Ruan. I'm a board-certified internal medicine physician, and I just got home from work. I'm kind of tired, but I'm going to talk to you guys about fibromyalgia. So, as we learned about fibromyalgia in medical school, there was a lot of misrepresentation about what it actually is. And I didn't really learn until I got out practicing in the real world and have people with the diagnosis of fibromyalgia. I'm like, oh, what's going on? Why are so many people diagnosed with fibromyalgia? So what does a typical fibromyalgia person look like? Well, what they look like is that they've been to a lot of doctors. They have a lot of tests done on them. They've been through a lot of grief, a lot of depression, and they come from a very long road of diagnosis, misdiagnosis, diagnosis, misdiagnosis, and it's really it kind of hurts me to see these patients as they go through this. Yes, they feel very misunderstood, and a lot of people with fibromyalgia are diagnosed with other different things like chronic fatigue syndrome. And you'll hear other people talk about adrenal fatigue, which you don't hear a lot of MDs talk about because it is not on our diagnosis code. We can't even put it in the medical chart because it does not exist in the diagnosis code. So, people who have fibromyalgia has a constellation of symptoms that include depression, that include pain everywhere in their body, real tender. Their sexual dysfunction, and they come from such a long line of hurt and depression and being shunned, not really just by doctors, but a lot of times by their families, by their friends, by their boyfriends, girlfriends, spouses. It really hurts them so deeply that it impairs the relationship with the people that are around them. And not only that, a lot of times their friends and their families don't want to be around them because of the fact that they think, oh, this is contagious, or this is something that I don't want me and my family to be exposed to, right? And that just hurts me, and that hurts a lot of the different people too. And so that is not something I learned in medical school. That's just something I learned in practice, right? And so, but a lot of physicians, when we look at somebody with a diagnosis of fibromyalgia, we know that, yeah, absolutely, Amy, it really consumes every aspect of life. But a lot of physicians look at someone with fibromyalgia and we know, okay, well, we have to spend some time with this person, okay? And not a lot of physicians want to spend time with somebody with fibromyalgia because it's really poorly misunderstood, okay? And for the actual diagnosis, you really have to really get deep into the conversation with the patient and the physician, and a lot of times there's just no time. And so I'm going to tell you how I deal with fibromyalgia. So fibromyalgia is a thing, okay? Fibromyalgia is a thing that's there, and it's a diagnosis, okay? But I don't focus on the diagnosis of fibromyalgia. I want you to tell me what's been going on in your life. Like, who do you live with? Do you have family around? What is it that you do? What is your daily job? Are you on disability? Do you have any friends? Do you have any resources? And what I find is that a lot of people with fibromyalgia have some sort of disconnect when it comes to them and their world, okay? And I'm not talking about something crazy disconnect here. I'm talking about other conditions and other disorders like hypothyroidism, diabetes mellitus, stress, anxiety, major depression, okay? Attention deficit disorder, that's a big one with fibromyalgia. A lot of them have been abused in their lives. Hashimoto's, absolutely. A lot of them have other autoimmune conditions like lupus, scleroderma, and all these different things, right? And so what I try to do with somebody with fibromyalgia is that I focus on what we can do now. Well, what can I do now for you in my office? What is it that I can help you with right now, so that I'm able to help you get through something. Your wife is a homemaker with no stress whatsoever. Homemakers does not mean that they have no stress. It goes a lot deeper than that. And plus, stress does not bring on fibromyalgia. Okay, fibromyalgia is a pain condition. It's a constellation of symptoms. Just because someone's not stressed doesn't mean that they can't have fibromyalgia. But there's some sort of physical or mental disconnect somewhere, and we have to really try to accommodate, especially with a lot of my patients. And I'm not going to talk about the treatment of fibromyalgia a whole lot at this time. I want to talk about how a lot of physicians view fibromyalgia. So the way I view it is that I need to take care of my patient mentally, spiritually, and physically, so that they're able to empower themselves to do something about their chronic pain. Okay. One thing that I really support is actually going gluten-free for at least a very short amount of time, because that has a humongous advantage in people with fibromyalgia. Marnie, how do many physicians view fibromyalgia? You have a really mixed bag. I'll tell you, most people, most doctors that I know, everybody has a different opinion. So, about half the people don't believe that it's a thing, and the other half is that, well, it's a thing, but we can't do anything about it. And then there's other people who say, well, we can just prescribe antidepressants and then it work really well. But it goes far beyond that. It goes far beyond just antidepressants. So people with fibromyalgia in my office, I talk to them alone and I say, hey, what is it that I can help you with? Okay, and the next time they come in, I'm like, I'm going to do some blood work on you, make sure you don't have anything else. And the next time they come in, I want them to come in to whoever their spouse is and whoever their support system is. I want to talk to them. I was like, hey, how is it that you guys feel about this person who has fibromyalgia? And I want to get to the bottom of how their relationships are, right? So, and it's not typical for a primary care physician to do that because it does take some time. And a lot of times I don't have any time. I literally just came from the intensive care unit about half an hour ago out of the hospital, and now I'm home and I'm exhausted. But a lot of physicians don't have time to deal with something like that. But time is not really the factor. It's communication that's the factor, right? There's a lot of ways that physicians communicate. I have people follow up very regularly with me, especially for those who have fibromyalgia. And really, because it takes many visits with me to develop a deep sense of what somebody with fibromyalgia is all about, all right? And there's 3 people that's currently watching this, and you guys are my patients, and all of you have fibromyalgia, except you guys need to see me more often. But we work with the underlying deficiencies, and deficiencies can be anything from, okay, well, if you're a diabetic, is your blood sugars under control? If you have thyroid disease, is your thyroid under control? If you have no medical history except this fibromyalgia, have you tried any remedies such as using food as medicine? And so, when I say using food as medicine, it scares a lot of my patients. Like, what do you mean, doc? I have to monitor what I eat? And so I have a very different set of patients from most people. Most of my patients are older. I would say they average probably in the upper 60s. They're in that Medicare age, and a lot of times they've been through their entire lives with pain and without really anybody telling them why. And then when I suggest using food as medicine, they're like, "Oh, doc, that's just quack, right? That can't be right?" But they actually do listen to me, and they derive a significant benefit. And so, hey, Dr. Liam, how you doing? They derive significant benefit from clean eating, going gluten-free. But I'm not saying all of them do, but a lot of them do. I have 4 people with fibromyalgia that have gotten off their narcotics, and I taper them off narcotics within like a month, which is awesome, after they went gluten-free, and they lost a lot of weight. They feel a lot better about themselves. Why is it hard to get answers from doctors? Okay, well, that's a political answer, right? A lot of physicians, it's hard to take time to talk about something like this because a lot of physicians are not trained to deal with fibromyalgia. Maybe like Dr. DM is, but I wasn't trained to deal with it, but I am trained to deal with humans, and my background is that I am an MD, but I'm the 6th generation of doctors on my father's side, and they're all Chinese medicine doctors, and my mom does acupuncture and herbs. So I grew up with the understanding of treating the human and not treating the disease. I grew up with the understanding that it takes a conversation to heal somebody and not a quick prescription. And that's something that I've always held dear to my heart. So yeah, I have an MD. Thanks, Cindy. I have an MD, but I have my principles and my values that are passed down to me from my grandfather, my father, and my mother. And so, but that's how I practice. Now, in answer to your question, thanks, Barb. In answer to your question, why is it so hard to get answers from doctors? Well, doctors don't have a lot of answers for this, right? And so, oh, absolutely. Yeah, medications do things to our body, and food do things for your body. Absolutely. The ultimate stigma here from a lot of MDs and a lot of physicians is that it's hard to deal with somebody with fibromyalgia, and a lot of physicians don't necessarily want to deal with it or know how to deal with it. And when a physician is untrained in a specific area, they send to either a specialist or somebody who knows what they're talking about, right? But that's exactly why it's so difficult to get an answer from a doctor, because the physicians are not really trained to deal with this part, because a lot of this is understanding what it is to be human, to read somebody, to really engage with somebody about how their lives are. And that is what the mainstay of fibromyalgia treatment is, to really understand somebody. And that is not something I think that's really teachable in medical school. And I don't think that's something, and that's going to be a physician by physician basis. I know a lot of good docs who are like me, and I know a lot of docs who are not, and so a lot of it is really dependent on your relationship with physician. So if you have fibromyalgia, here's what I recommend for you. You find a physician that you're able to speak with, and it doesn't even matter what specialty they are. You find a physician, a rheumatologist, internal medicine doctor, family medicine doctor, pediatrician. You find somebody that you can speak with, that you can let out all your symptoms without fear of being judged. And that is extremely difficult when you walk in a physician's office. But there's people everywhere that can help you. If you're not satisfied with your treatment from your doctor for your fibromyalgia, well, then there's other people with other different views. Don't assume that all MDs are the same, because I am very different from a lot of MDs. Don't assume that, okay, I'm just going to go to this doctor. They're just going to keep ordering tests. It's like, okay, well, we can order tests, sure, but do you have to get it? No, you can get other opinions. It's absolutely your right? And now there's something that I want to touch on that it affects everybody, but nobody talks about. Yes, it seems when I want to go to doctors, I have a list and they don't have time to hear it. Oh, I love lists. Make a list for me, please. I like to go down the list so that we can check everything off. I'm a very list person. And so, but I want to talk about something that not a lot of people talk about, and that is health insurance, okay? A lot of people either don't have health insurance, they have a high deductible insurance, they have issues paying for their medical care, all right? And that's what I deal with every single day, because I'm a partner in my private practice, so I understand the finances. So if someone has fibromyalgia and they already have limited resources when it comes to health insurance, and they're like, well, I can't just go to doctor shop around and see, hey, is this doctor going to deal with my fibromyalgia and prescribe me medicines that are cheap, or is this other doctor going to listen to me about it? People with fibromyalgia without health insurance has a limited resource when it comes to medical care, right? So a lot of people search online, right? And you can find a lot of different things online, but I would say 80% of the stuff that's online is a lot of BS. But you have to know where you find your resources, right? And so, this is where Periscope is awesome. This is where Periscope is great, because how practitioners feel about certain subjects, and now how I feel about fibromyalgia. And you go to information such as this. Online gives you anxiety attacks. Me too. You go to different people who provide information of value to you, and you research them. And if you go to a doctor, be open to say, hey, you know what, I did see this online. If the physician rolls their eyes when they do it, then you probably need to see another physician. If the physician is very receptive, okay, well, what is it that you found online? Maybe you can help me and teach me, because that's how I am. Then maybe that's a physician that you can talk to, right? We're not taught everything in medical school. Let me tell you that. We're not taught nutrition. Nutrition was an elective in medical school, and I didn't even take it. Because my background is that I know a lot about nutrition through my family, who's a Chinese medicine. And most docs don't take that nutrition school in med school because they rather do a surgical elective, or they rather do ophthalmology. That's a lot more fun, a lot of instant gratification, right? Nutrition doesn't have a lot of instant gratification because you can't treat somebody and cure them right away. And so people in medical school are younger, and I really enjoyed, treating things right away and getting instant results. And that's a human nature thing. It's not really a doctor thing. That's just a human nature thing. But that's why we're not really trained in something like chronic fatigue syndrome, fibromyalgia, adrenal fatigue. I was going to say adrenal insufficiency, which is different from adrenal fatigue. And so, when we go through a system through training like this, we treat our patients based on what we learned. Okay. And yes, I didn't learn a whole lot about nutrition, but I knew about it from my family. But if I came from a different family, I would not be on this scope right now, probably even talking about it. I'll be practicing medicine based on what I've learned in school. And but I'm fortunate to be exposed to all sorts of medicine. And I don't care if it's Eastern medicine, Western medicine, African medicine. Medicine is medicine. As long as you heal somebody, we should use those resources. We should use those resources to help our patients. And so, and I'm not one to really talk about supplements. I'm not one to talk about different diets and stuff like that in this particular scope. I'm one to be very real with you guys on how the medical world perceives somebody with fibromyalgia. Okay. I feel that, people with fibromyalgia, or a lot of people with fibromyalgia, feel very left out, and I feel bad for them, but there's always something that we can do, especially at every visit. And so, I'm going to end the scope because I'm exhausted. My day started at 5 a.m. and it is 9:04, and I just got home. And so I will talk to you guys later. Oh, if you guys please want to follow me, it's facebook.com/healthydoc. And if you really like what you heard, thank you. Thank you for your time for listening to me. If you like what you heard, please share the scope. Swipe left to right on iPhone and down to up on Android, and share the scope on Twitter, Facebook, whatever it is that you want to do. No problem. And I think I wrote an article about fibromyalgia a while ago, but it's not talking about anything like this. But I'm going to post it on Twitter and Facebook when I find the link. It's been a while, so I hope you guys really enjoyed this. Anybody have any questions? A lot of people invited followers and joined, but I'm about to get off. Oh, thank you very much. I appreciate that. This scope is something that I think of my colleagues watched it. You know, they'd be like, "Doc, what are you doing?" But I really enjoy talking to you guys. Really enjoy talking to you about my viewpoints and how I practice medicine. But it is something that is really near and dear to me. You know, someone asked me earlier if I won the Powerball, what would I do? I'm like, I wouldn't do anything differently. I will still practice medicine. I still help people. I love what I do. And my Facebook is facebook.com/healthydoc. HEALTHYDOC. Okay? Alright, guys. I have to go because I'm exhausted. Alright.